The Entertainment Industries Council and Novo Nordisk, a global healthcare company and world leader in diabetes care, present Picture This, Diabetes.
Welcome. I'm Brian Dyack, President and CEO of the Entertainment Industries Council, and it's really wonderful that you are all here today for this webcast with Fox Chicago. The organization that I represent, Entertainment Industries Council, is generally known as EIC. We've been active in the health field for about 28 years now, and I would like to kind of remind you maybe of some of the things that are going to be important as we go through today. Most importantly is this is really about Chicago and it's about you. So that's really the focus as we start to look at top-line messaging. Again, a little bit about what the Entertainment Industries Council does. We really serve as a catalyst for social change. And our access to the entertainment industry and local media helps to create the kind of synergy where issues can be looked at, prioritized, and most importantly, messages can be developed that ideally reach very specific target populations. Again, I want to reemphasize that this is really about you and the people here in Chicago. Those of you that work in the field of healthcare and diabetes, you have the knowledge, you have the heart, you have the passion, you have the data, and what you give us in the media is content. And that's an extremely valuable resource for us. You give us real stories, and you give us a direction to go in. And that's exactly what we want to establish here today. As we've done these diabetes Picture This forums in some other cities, the most unique thing is that every city really does take on its own characteristics. The priority messaging that we've discovered in Atlanta or Seattle is different and will be different than what is discovered here in Chicago. And so this is, again, your opportunity to do something unique and to also be a part of really refining the kind of message that will work in this market or in your city. It's now time to introduce Representative Jim Durkin. Thank you for being here, and I'd love to hear a little bit about the Diabetes Caucus.
Thank you, and thank you for inviting me here today. Myself and Representative Mike Tryon. You might hear from Mike in a few moments, but I really, diabetes was never really much of an issue with me. Didn't think much about it until about 18 months ago. We got a phone call from our pediatrician saying that you have to bring your daughter to an emergency room. This was the first day of school break, June of 2009. And from there, we started this journey in which she was diagnosed with type 1 diabetes at the age of, she was a little less than 9 at that point. We did our 4 days at Children's Memorial Hospital, in which she needed to become regulated. I had no idea what hit me, nor my wife, nor my daughter. We're doing better now. I learn a little bit more every day, but I'm a parent who's trying to look for answers, a parent who's trying to understand what this is all about, a parent who's trying to see how did this come about and what can we do as parents, but also in my position as a member of the legislature, is there ways in which we could help move the ball forward. And to me, one of the issues that strikes me is that we need to do a better job of educating the public and also perhaps members of the media. My daughter, at the age of 9 or 8.5, she was active. She ate she had very good nutritional habits, and we made sure of that. So we talk about diabetes, we talk about obesity, but sometimes people forget that there are two types of diabetes. There's type 1 diabetes, is what my daughter was born with, who is a basketball player. She's an athlete. She eats healthy. And also there are people who have type 2 diabetes for a variety of reasons. They develop that infliction. So one of the things that I've learned as an adult, particularly when I'm new to this issue, is that I shouldn't stay on the internet and try to research issues on the internet any longer. The internet could be a great thing, but it could also be very scary. That's one bit of advice I'll give to a parent or a family or someone who has a loved one who's been diagnosed with type 1 diabetes. Limit your time on the internet. Talk to the professionals, because you'll drive yourself nuts. But Mike Tryon will talk more about this, because he really has been the person who championed the Diabetes Caucus. But I'm Assistant Minority Leader in the Illinois House of Representatives. And the Minority Leader is a very good friend of both of Mike and myself. It's Tom Cross. His daughter was diagnosed with type 1 diabetes approximately 12 years ago. She's starting college. So we do have members of the legislature who are very involved, know the issue, but we have obviously a very sympathetic heart towards the issues that go along with diabetes. But the whole purpose of the Diabetes Caucus was basically to bring awareness to decision makers, not only members of the legislature, but also within state government, but also be ones that have a voice, who can actually educate people, but also perhaps shape policy as it deals with healthcare and management issues of diabetes. So that's the function of the caucus. I'm here. I'm glad to be here. I'm glad to participate. But unfortunately, I became involved with diabetes the hard way, and it wasn't voluntary. But I'm here to say that my daughter is doing well. We have a long road ahead of us, but I'm optimistic that we will be at a point someday where things will be managed much easier, and we won't have to deal with some of these issues that we are experiencing right now. So I appreciate this opportunity. Thank you very much.
Thank you very much. And the willingness to share your personal life with others is really an inspiration to be able to, I think, help set the tone here on what we're trying to do when we're looking at developing stories and developing the resources that we need to tell those stories. I'd now like to introduce Mike Tryon. He served in the Illinois 64th District since 2005. Currently serves on the House committees devoted to health care availability and access, and environmental health and healthcare disparities. He also serves on the bipartisan Diabetes Caucus. Thank you, Mike, for joining us today.
Thank you, Brian, for having me.
Thank you.
It's great to see a forum like this, one that would involve people who have an interest in reaching out and helping people all over our state. And let me begin by saying that after 5 months in the General Assembly and eating the life and diet of Springfield, I went home, wasn't feeling well, went to the doctor, and was diagnosed with type 2 diabetes. So that began my journey and my passion for this disease. And like so many people when they're diagnosed, they're not really equipped with the knowledge to take on such an issue, a health issue that requires the kind of management that diabetes requires. So I began that journey, and as I began that journey, I found other legislators in Illinois who had diabetes, had a family member who had diabetes, and had that same passion. And out of those passions arose the Illinois Legislative Diabetes Caucus. And it consists of 40 legislators in Illinois who are committed to discussing, evaluating public policy issues that affect diabetes and the advancement of education and treatment and prevention programs in our state. When you look at the statistics in Illinois, the Center for Disease Control actually has Illinois and 9 other states as the 10 states that will face the biggest growth and problems with this disease. Illinois today has about 10% of its population currently has diabetes. In 2025, over 2.5 million Illinoisans will have diabetes. In 2040, it's estimated that 30% of our state will be affected with diabetes. We're not equipped to take that on. The cost of taking that on is very expensive. The public policy decisions that lie before us that need to be made to handle that type of disease onset is something that we need to start discussing today. And just maybe we might be able to prevent that statistic of being in the top 10 in this disease. But this is a national phenomenon. We see states in the southern part of our country who already have 15% of their population or are approaching 15% of the population with diabetes. In Illinois, we we have the population in the United States that has the highest incidence per capita of diabetes of anywhere in the country, and it's Humboldt Park. 21% of Humboldt Park has diabetes, type 2 diabetes, and they have a grant that they're working on there, established Illinois Diabetes Center there, and some very creative programs are coming out of that, where they are genuinely making efforts to educate restaurants in the area, educating their constituents in the area. They even have a door-to-door testing program, and I think we're going to see good data that comes out of this program in Humboldt Park. But legislators across the country, I think, need to be discussing this. And this is certainly an opportunity to have a forum like our forum grow to every other state, at least the top 10 states that are going to be facing this challenge. Illinois is anticipated in 2025, or Illinoisans will be spending about $20 billion in treating this disease. That's a lot of money. That's not state money. That would be what all Illinoisans will be spending. And that's a strain on our economy when you take that kind of money out of consumer products and put it into medical products. And maybe if we focused and spent money and effort in prevention programs, we could make that change. The one thing that happened to me when I got diagnosed with diabetes, I think that's what happens to so many people that I have talked to, they actually end up going on a high-protein, high-fat diet, which is what I did. And I think that's a mistake many of us do. And you end up not getting and gaining good control, not feeling much better than you felt when you got diagnosed. And what I found made the biggest difference was getting involved with diabetes education. And self-management of this disease is the success stories that I hear. When you learn how to manage it and control it, it makes a big difference, and a difference that I think we need to be talking about, how we bring education to our population. We have about 11% of our population as part of our Medicaid program, and our Medicaid program doesn't cover diabetes education. So that's something that I think we're going to be talking about. In the General Assembly, just in the last 2 years, our caucus has been actively promoting things like the Students with Diabetes Care Act, which we passed a law that requires each school to be able to have somebody educated and assisting students on how to administer their drugs. So education, treatment, I think, are where we want to focus our diabetes efforts in Springfield and go from there. So I want to thank you for this opportunity to be able to come and talk about this. We think putting policymakers and stakeholders in a room together and having a discussion, only good things can happen, and hopefully we'll continue to see forums like this to address this issue. So thank you.